Can you ask in English?
Yes. It's not a question. I completely agree with you. And the whole discussions about adding energy-based devices to the liposuction and lipedema patients. If you're convinced, or if you're not, it's so easy to make a clinical study by performing the liposuction on both sides, and of course in the same way. So in after liposuction, you throw a coin, and then you see which side you will add the energy-based devices as an energy-based device, or and then prove it. It's very easy. And when I propose them to colleagues who really are in favor of using them, they say, you cannot do that because then you can get another result on the one side, on the other side. Basically, that's, if you're so convinced that that will happen, that's no problem when you propose that to, especially to the serious lipedema patients. They don't worry about a little difference from one side to the other side, apart from the fact that you could get other energy-based devices. So please do the clinical study. They are easy.
That's a great point, and it should be done. We do need to study this. I actually had an IRB to study this, but then I chickened out because I was concerned about the concern about possibility of damaging something in the legs. So I chickened out. I have to apologize for that.
Thomas, thank you very much for the very nice presentation. I have a question. What do you think about that? If you use laser for lipedema patient, can you have lipedema after 5, 10 years? We have no any research about that. I think this is not good if we use that.
I mean, that's a valid concern. I think we just don't know if it could have a long-term impact.
Dr. Wright, thanks for that presentation and covering all these technical devices. So, laser and RF have shown this kind of tightening. So there is no reason not to use it, I think. All here in the room are working for 20, 30 years on these topics. And I have to say, the number of really good clinical studies, original studies, is not so high. Even we self-critics here in this community. So I don't think that you need to do such a study, because it's proven that you have about 25% of shrinkage. So particularly in the inner thigh area, where the skin is loose, I think it's standard care that you do an energy-based device on top of a liposuction. And there is no hint currently that lymphatics is damaged after any kind of treatment. Not by liposuction and not by energy-based devices.
Thank you, Thomas. Ich glaube, wir müssen weitermachen. Thank you very much.